We're going to talk about 2 tips that you can do at the comfort of your home to see what type of back pain you have. So many times people call me on the phone and says, they ask me, I have this back pain and I wonder where does it come from? Is it my low back? Is it my tailbone? Referring really to sacrum. This is really what it should be called tailbone, but most people refer to sacrum as a tailbone, which is incorrect. However, I get a lot of these questions to see where the low back coming from. So I'm going to talk to you about 2 simple tips that you could do at home to see where is it really stuck in your back. This technique that I'm talking about is called Sacral occipital technique that a lot of chiropractors are familiar with. So the first one you should do, should put your feet together and simply stand and ask somebody to observe you. Now, of course, I'm going to exaggerate so you can see the difference. It's not going to be this exaggerated when you have pain or when you have problem. So if you see somebody close their eyes and then wobbling back and forth, and you have to be patient because it takes a couple of minutes so I start doing the movement. Usually when they do that, this part of the spine we call sacrum, this is usually fixated or locked. And why we go back and forth? There is a fluid that goes around the brain and comes all the way down next to the sacrum and goes back up. What happens every time we breathe, our gastrointestinal system presses down and this piece of bone goes back. And when we breathe out, it goes forward. And that creates a pumping action for our cerebrospinal fluid to move. So obviously when this thing is stuck, our body compensates by wobbling forward and backward. Even you see some elderly, when they completely fuse this and it doesn't move anymore, like when they are in their 80s or 90s, you will see even when they are sitting, they're moving back and forth, or they completely always moving because their body tries to move this cerebral spinal fluid all the way to the top. Now, this is the first one. In SOT they call it category 3 or sacral occipital technique. Now there is another back pain that usually comes from your pelvis rotation. Either pelvis rotate this way or this way. Okay, this is in sacro-occipital technique in chiropractic, we call it category 2. Now, same technique. You put your feet together, close your eyes, and you be patient to observe. It doesn't happen immediately, or sometimes it does if it's severe enough. And you will see the person wobble side to side, like this. And this is caused by rotation of this bone, we call it iliac. And when the iliac or sacroiliac joint is on discomfort, on one side is locked and is rotated. If you observe my leg, basically I'm going to show it here. If this thing moves backward, it creates an apparent short leg. Doesn't mean your leg is short, but because of this rotation, it creates apparent short leg. What that means, that one side of your body obviously is shorter, and you tend to move that way. So that movement, your sacrum is still stuck because of the rotation of the pelvis, and instead of you going back and forth, your body does this movement. And it's because of the rotation of your pelvis. Thank you for watching this video. Have a great and healthy day.